It is a condition that makes thousands of people sick each year, but what exactly are foodborne illnesses and what is causing them so we can protect ourselves so we're not affected by them? Here to explain that and much more is Dr. Kevin Comar. He is back. He is a physician at the Borland-Groover Clinic. It's good to see you, Dr. Comar.
Good to see you too.
Appreciate you being here. This is something that nobody wants to deal with, and we'll get into what causes it, how we can protect ourselves in a second. But let's talk about your role at Borland-Groover, what you do.
I am a general gastroenterologist at Borland-Groover Clinic. Borland-Groover Clinic is actually the largest gastroenterology clinic in the Southeast. We've close to 50 physicians, over 50 physicians I should say, and take care of over 100,000 patients a year, close to 50,000 procedures a year.
So you guys have this down to a science when you're seeing 100,000 plus patients every year with 50 physicians.
Yeah, we see a lot of patients. We have a lot of subspecialties. We have experts in all forms of GI, whether it comes to colon cancer or hepatitis or inflammatory bowel disease. We're a very large group.
And there's a reason why we're talking about foodborne illnesses today, because you say in the summer months we start to see a little bit more of this. So we'll get into why in a second, but first, what are some of the symptoms that we might be experiencing to know that we have this?
You know, the typical symptoms you get with foodborne illnesses, food poisoning, are nausea, vomiting, abdominal pain. You can get diarrhea, you can get bloody diarrhea, even fevers. A lot of flu-like symptoms combined with a lot of GI symptoms.
Okay, so what are the common causes of this? So what are we eating something that we shouldn't? How do we know we're eating something bad?
It's typically contaminated food, typically the pathogenic viruses and bacteria. There are lots of viruses and bacteria that can cause it. The common ones that you always hear about are things like Salmonella, E.Coli, Campylobacter, Noravirus. It's just bacteria being in the wrong place, kind of festering, growing, and consuming that bacteria.
Actually, at the Republican convention, they had an incident where there was a delegation, I think, from maybe California. I forget where it was, but it was the Noravirus.
Noravirus,
and they
exactly.
say but once someone catches it, isn't it very contagious from that point forward?
It is very contagious, and that's where, you know, proper safety controls, good hand washing is very, very, very important.
Okay, so why now in the summer? Why are we seeing more instances of foodborne illnesses?
You know, the summer months are a perfect environment. The hot, humid weather is a perfect petri dish for some of these viruses and bacteria. In addition, during the summers, there's a lot of outdoor cooking, you know, picnics, barbecues, situations like that. A lot of the safety controls like proper refrigeration, using a thermostat, cross-contamination occurs a lot of the times. It's just a perfect environment for food poisoning.
So you just have to make sure that you're extra conscientious and things are cooked thoroughly, and like you said, the cross-contamination, be concerned about that. Okay, how, first of all, I guess we have to identify it, right? Because we have to realize it's not the flu, this is actually a foodborne illness. How do we then treat it?
Fortunately, most foodborne illnesses, food poisoning, are self-limiting. They kind of resolve on their own. Hydration is the key. Now, obviously, if you develop more severe symptoms like severe abdominal pain, significantly high fevers, symptoms last for more than 1 or 2 days, bloody diarrhea, things like that, you need to see a medical provider at that point.
And you say the best way to prevent this, I mean, making sure you're taking proper precautions, washing your hands.
Yeah, wash your hands, do not cross-contaminate, clean surfaces, things like that is ideal.
Okay, let's go back to real quick because we have extra time. What are, when we say E. coli, we're saying these different, where are these bacteria coming from that we can make sure that we're, washing the food properly? Or I know sometimes we'll see these alerts that say, this batch of spinach or whatnot was contaminated with E. coli. I mean, how can we make sure that we don't get this?
I mean, there's no 100% way to guarantee you're not going to get food poisoning. Food poisoning is very common. The key is proper cooking, proper temperatures, clean surfaces. The bacteria can be spread anywhere from the factory to your countertops at home. It's just really good cleaning techniques is the key. Making sure you have proper refrigeration, especially in the summer months when you're cooking outdoors. When in doubt, I always tell my patients, if there's any doubt, with leftover food, you want to throw it out.
Yeah. Yeah, so I've got a whole refrigerator full of when in doubt, just pitch it all. At what point in time, though, should someone come and see someone such as yourself?
I always tell my patients most symptoms resolve in about 24 to 48 hours. If the symptoms persist, if the pain is severe, if the diarrhea has blood in it, these are alarm symptoms. And these are warning signs that you need to seek medical help and see a medical provider.
Okay. Good to see you, Dr.
Good
Comar.
to see you, too.
Thank you so much. We appreciate
Thank
you
you.
being here. Make sure we're taking care of ourselves as we get into the summer months. And we'd like to thank Borland-Groover for coming on and sponsoring this segment. And for more information, you can always visit their website, which is borlandgroover.com, or you can call them 904-398-7205. All the information is right there on your screen.